Well, this morning we're talking the importance of support systems with September marking National Recovery Month and National Suicide Prevention Month, both highlighting the challenges of mental health and substance abuse disorder. And joining us today is Dr. Corey Richardson of ICGH to talk to us about this really important topic. And let's just start with here, the significance of the month of National Suicide Prevention and also substance disorder.
So for us, it's an opportunity to bring awareness. And it's about families and individuals across North Carolina to open a conversation about two critical issues that affects millions of people, and that's addiction as well as mental health. And to let people know that you're not alone, whether it's you, a loved one, or a family member, that there's a help now that works and that it's available today.
Now, fentanyl crisis back in the day was taking a lot of people.
It still is.
Yeah, it still is. Okay. Well, let's talk about how ICGH is addressing the mental health and also substance abuse.
So we use an integrated approach, and that means that the traditional methods are just not effective. We have specialized training for our doctors and therapists, but we also incorporate peer support specialists. We even have pediatric nurse practitioners and developmental health, as well as psychiatric nurse practitioners. And so it's that kind of ability for a variety of providers offering a variety of interventions, from medication management, counseling, eye movement desensitization for trauma, as well as peer support, recovery housing, supportive employment, and a lot of other needed interventions.
You call it recovery, not treatment, correct?
Recovery is overarching interventions to help, like recovery supports. Treatment is incorporated there, and we have recovery-focused treatment. But the idea that the old way of just doing some talk therapy or one prescription is enough, it's not working. We've been, as you mentioned before the segment, we're this ongoing crisis between suicide and overdose deaths. Mm-hmm. And the only way to get it to end is using interventions that we know work.
You also are engaged in the community. How so? How are you going to engage in the community?
So ICGH is a very different company in that we work directly with county, state, and federal agencies to secure support and funding, as well as create strategic plans that really address the root causes of addiction and mental health crises. And so in some counties, we're located in the health department. In other counties, we're inside detention centers and shelters delivering direct care. Out in the community, we're delivering through our mobile medical units direct care to the unsheltered populations and moving them right into recovery housing.
So how do you continue to get this word out? With television, with media, with education? How?
So September is a great opportunity. We have summits, we have conferences year-round, we have outreach events. But talking to you today is a perfect example to let people know that addiction and mental health is just like any other medical condition, like heart disease and diabetes. There are effective treatments at work. You are not alone. If it's yourself, your child, someone that you care for, you can get enrolled today in treatment services, turn your life around, and then open the door to lifelong recovery. You
are not alone indeed. IntegrateCareHickory.com is the website, or you can call 828-322-5915 if you need information. Thank you very much for being here, Doctor.
Yeah, thank you for having me.